Okay, so I'm going to attempt to do a video on neonatal resuscitation, mostly because it's the thing that I really get probably the least practice in doing besides IVs. And however I can get around to practicing it, that's great. We do a lot of like just, 5 breaths, but not like the full shebang. So let's see what I can manage to do. I did kind of a creative little thing with this because I do not have a doll that I could ideally work on. So hopefully you guys can see what I drew here. This is my baby's face and head. And then I drew like a picture of the baby's body so that you can see where kind of like the nipples and the chest would be versus the stomach here, so that when we get into the compressions, you can see where I go for doing the compressions on the baby. So reasons for needing to do resuscitation start with the baby not being able to breathe or not breathing efficiently enough. They're gasping, or their chest wall is inverting and looking crazy, and or a heart rate that is under 100. So baby comes out and they're not breathing well, their heart rate isn't so hot. This is the bag that you'd be looking at using, typically speaking, with the mask on here. I'm not working with a preemie mask, just a regular sized newborn mask, assuming that we won't be dealing with a preemie in this scenario. And you want the smaller end here up over the nose. You want to go over the nose, down, and kind of just like at the chin level. So that's where this mask should be sitting at on the baby, is all the way over there. And you should make sure that you have a good seal. Before ever doing this, you want to make sure that when it's properly sealed, that you're seeing that it's inflating well, and you got your pop off there at 40 centimeters. So you're going to position the mask that way. The baby, obviously, you're going to want to warm and dry the baby. We've done that in that process, I'm assuming, of assessing that the baby isn't breathing well enough. And the baby is now laid out with like a roll or something over the neck to kind of keep the sniffing position, not to where the head is too far back or too far forward to obstruct the airway. Make sure that there's not anything in there that needs to be suctioned, really. Although you can also do kind of where you have the baby, I don't know if I need to get into all that, but where you have the baby at a fair angle like this with the head down to help the fluids come out. But we're going to say that that's not an issue, and we just need to get right into bagging this baby. So we're going to position the baby's head where it needs to be. Now, ideally, you're going to be off to the side with your bag here so that you can see the baby's chest, because what you want to watch for is chest wall movement so that you can assure that the air is getting into the baby properly. So you're going to hold a nice firm grasp to try to hold the baby's head in position. You might also have a second person helping to keep the baby in the position that it needs to be. This is often pretty tricky. Also, too, we would have probably wiped the face a bit so that it's not slippery and wet, because it also makes it harder to get a proper suction. So you're going to kind of hold it steady, and you can sort of use your fingers to keep the baby's head and chin in the right position. And you're going to start with lung inflation breaths, which get you up to about the 30 to 40 range. So in the yellow is where you want to go for at least the first 5 breaths. And typically what they want is for you to give ventilation for the first 15 seconds before checking the heart rate again and seeing if the baby has started to breathe on its own. In my experience, the baby usually barely gets through 5 breaths before it starts pushing you away and going, no, 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 okay, thank you so much. I appreciate that. I got it now. But again, we're going to say that this is a scenario that the baby is not quite as vigorous as all that. So we're going to go breathe and 1 and 2 and 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 breathe. And that's 5. We're going to say that we did that for 15 seconds. And it looks kind of like this. You're going to do like a steady 1 and 2 and breathe and 1 and 2 and breathe. Steady up to that 30-40 range. And then we're going to check with our stethoscope, which I didn't bring, I'm sorry, stethoscope to check for the heart rate, see what the lungs sound like. You know, ideally the heart rate. If the heart rate is at or above 100 and the baby has started to breathe on its own, perfect. You're good to go. You don't need to worry about anything else. But if the heart rate is dropping or not, or staying steady, then you can move into, and let's say 2. Let's say that the air is getting in and everything is suction. The mask is suctioned the way that it needs to be, and you're getting good chest wall movements and everything. The heart rate just still isn't there yet. Then you're going to go ahead and continue to ventilate just like you were. Except now we're going to go just to the 20 centimeters of H2O, and we've already done the lung inflation breath, so we're going to go ahead and go into just the breathing for the baby to get the heart rate up. And you want to do that for another 15 seconds before you check. In all, you don't want to move into anything else as long as you're staying effective for at least 60 seconds if the baby is still just not getting the heart rate up where it needs to be, not breathing well enough just yet. So continuing to do breaths at a smaller amount. So breathe in 1 and 2 and 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 breathe in. We're going at the 20. Breathe in, breathe in, breathe in. So just a little bit less, and you want it to be kind of steady. If in this process, you know, before we've gotten to this point, your chest wall movement isn't there, you're hearing kind of that like farty sound, it's not, the suction isn't happening, or again, the chest wall movement isn't there, then you go through the MIST or SOPA, which is, readjusting the mask, repositioning the head. S is for like suction and making sure that there is not anything obstructing the airway. And going through that whole entire process. Mr. S-O, O is A-O. Alternative airway for A. O is something else. P is, yeah, so you get it. So you're going to go through that process and do like your different checks to make sure that you're getting the ventilation into the baby properly. All right, so let's say that your 60 seconds has gone by with effective ventilation and the baby's heart rate is at or below 60. Then and only then should you be doing compressions. Like that is the only time you want to do compressions. Every other time you're kind of readjusting and doing what you can to get better ventilation into the baby. So if and when the baby comes down to 60 beats or less for the heart rate and you've done effective ventilation for at least 60 seconds, then you can move into compression. And this is a 2-person job, but I'll kind of just show you what each person would be doing in that case. There's also kind of a couple different ways. I think the best way to do it in this case for the compression is, again, you have your mask this way, but now you're going to have the bag up above the baby's head because you're going to have someone else on the other end of the baby doing the compressions while this person is doing the ventilation, continuing to do the ventilation, but alternating with the compressions. The person doing the compressions is going to be on the foot end of the baby, and you're going to hold the baby. You can do it either this way, where you're going to have your fingers, your two fingers here, right kind of just at or right below the baby's, kind of like the baby's nipples. So you don't want to be down at that lower part of the baby's sternum, but not over the xiphoid process. So right between that area, you can do it from the side this way, and you're going to want to hit about 2/3 of the way of compression down through the baby's chest. Not all the way down, but not too light. You want to get a good enough compression to where you're going about 2/3 of the way. So you can do it from this direction, or you can hold the baby's back from under here and then use your thumbs. But I don't know, I feel like that kind of changes the way that the baby's head is sitting and can be kind of funky, but it all depends on what situation you're in and where the baby's at. So when we're alternating with that, the compressions are going to be 2 for every 1 breath. So you're going to go 1 and 2 and breathe, and 1 and 2 and breathe, and 1 and 2 and breathe, and your fingers should never really come up off of the chest. You keep the fingers there at the chest so that you can really hit it each time. Hit it each time. 1 and 2 and breathe, and 1 and 2 and breathe, and 1 and 2 and breathe in. And so you're saying this out loud all the time. And I think it's after 60 seconds of compressions with ventilation that you can have take a quick second to check the heart rate and see where the heart rate is. And you just kind of keep doing that until you can get the heart rate up. Obviously, during this whole entire process, if we're getting to the point where the baby's not coming around like pretty much immediately within the first minute or so, then, you know, you have ambulance, you have something coming where you're going to have help coming up here pretty soon. So you just keep working on that baby until you have help or you have the baby come around, ideally. And yeah. That's what I know about positive pressure ventilation or neonatal resuscitation. I'm sure that there's a couple bits that I've like kind of not said or said incorrectly. Hopefully you guys can kind of like see my little model that I have here, this makeshift thingy. And yeah, let me know what you think. Let me know what I forgot. Let me know what I need to fix. Tips, tricks. I'm always in for it. Thanks, guys.